a man-made disaster situation and probably come to the situation of Barlas.
Thank you so much, Ishaq. Thank you so much.
I have been very unlucky that I couldn't be the student of Professor Mushtaq Margoob sir, because the time we left the medical college, sir joined after that. And trust me, there is no program in our, I would say, Sikkim's Medical College, Bemina, erstwhile JDC, where Majid does not describe him as his great motivator, as his great teacher, and that's how I came to know more and more about Mushtaq sir. It's through Majid that we get to listen to these things time and again. And today, one of the most wonderful things I came to know about is not only being the guide, the teacher. I think he is really born to be the greatest psychiatrist, Mushtaq Sahab, because he was given the rubble, he converted it into a meaningful institution. The burnt out hospital, what he rightly said was that time, once we were interns there, it would send shiver through our spine to see the fate of those patients there, somewhere chained, somewhere being just treated with medicine. And it was like a simple Pagal Khana, what sir really described it. So it was horrifying. It would distract many of us from psychiatry rather than opting for psychiatry.
That people, they go to the settlers, they are there at the doorsteps of these people, and then they connect with them. The patients and the families also connected with them in a,
But that's what this Access Open Minds is to do a national youth mental health project. But the whole idea of the project was, even in a rich country like Canada, most youth were not getting any care, even with serious mental health problems. And the problem was particularly bad, it always is bad, in the indigenous communities because they're so poorly resourced. So through this project, we had about 16 sites. And one of the reason I mentioned this is that the idea was the psychiatrists will not be able to fill the gap. So the model we applied was we trained professionals, like nurses, social workers, to do the frontline assessment with no waiting list. The idea was that everybody should be seen in 72 hours.